Hey, this is Dr. Green, and in this video we're going to go over hip external rotation, passive range holds and lifts. So to start, we're going to start with the hold. So we're going to start in the 90-90 position, but specifically for this, we're actually going to have Dr. Joanna go down on the elbow. The reason for this is so that we have a little bit of range to be able to take the hip into external rotation there. If she's a little bit too much upright, that's already going to be a max external rotation position. We can't get any range through. Okay, so we want to start a little bit off, kind of like leaning on the elbow there, making sure the back is straight and the hip is in a good position. And we're going to use the block here to be able to passively take the hip into external rotation in that position. So for the holds, what we're going to do is we're going to have her contract the muscles on the inside of the hip to be able to pull her into that externally rotated position. I'm going to pull the block away. She's going to hold that position, and then I'm going to return the block to let her relax. Okay? So one more time, making sure she's not compensating with the back. All the action is happening in the hip, and then bringing it back down and letting it relax. So we shouldn't see too much kind of like wiggling or swaying or extension of the back to try and get that. It's just going to be holding at the hip, nothing else moves, tension in the core, and then let it relax. Okay, now we're going to work on the lifts off. So we're going to start with the foot on the ground, and then the goal with this is, again, only making sure that the hip joint moves, and then seeing if we can get her to lift that foot off the ground, keeping the knee on the ground, holding, and then bringing it back down, right? One more time, slow and controlled lift, taking it to end range, hold, and then back down. So that's external rotation at the hip for passive range holds and lifts, which are great exercises that we use to help people improve their hip mobility.